A study that we told you about yesterday concerning antibiotics, reigniting the debate about whether or not you should finish the course of antibiotics. The latest study, published in a British medical journal, has said no, that you should not finish the antibiotics. In fact, they claim that the whole story about finishing your antibiotics is not based on any solid evidence. And so the argument continues, and that's where it continues in the medical journals right now. As I'm always saying, if you're ever in doubt, talk to your pharmacist. Mark Rosenhek from Markie Pharmacy joining us again, and love having you in.
Thank you.
People forget about their pharmacist sometimes. I want to get in and see my doctor. I want to get in and see my doctor. I want to get in, and they can't. But they can go and get so much good, solid advice when it comes to medication from a pharmacist. So let's start with this antibiotic study right now. What do we need to know about it? Should we stop taking our antibiotics?
I think we should still keep taking them until there's further confirmation of this. But I think the takeaway is people are taking too many antibiotics. And I think they have to realize that a successful office visit doesn't have to end with an antibiotic prescription.
How much pressure is there from the pharmaceutical companies towards doctors you say people are taking too many antibiotics? Do you think it's just, is it that, or is it just, it's just an easy thing, doctors are overworked?
I think it's a combination of both. And I think it's the doctors that are thinking we'll give the people a prescription and they'll be happy and they'll leave content.
What's the danger of taking too many antibiotics?
You just become resistant to them. There's just too much use of them and they don't work anymore.
So you're going to get sick with something else down the line and
it won't work.
Yeah. Okay, how can you counter this?
Well, there's other treatments. There's just non-antibiotic treatments, or let just the things run its course. Most things will clear up themselves.
I'm glad you're in, because there are so many things. We are a society of medications. Right. We have a lot of different medications. Right. Myself, I'm on antidepressants. I'm on what else am I on? I'm on blood pressure. I am not on. But besides, I want to talk to you afterwards about that. No, I don't. But there's things we're doing wrong. What is the #1 thing you see people doing with their medications that's wrong? Well,
they share them. A lot of people say, I have 10 pills left over. You got the same thing as me, and I'll let you take it. The sharing is very bad. People don't always store their medications in the right place. They put them in the bathroom, which is the worst place to store your meds because of the humidity and because of the heat.
Where should your medication be?
Should be just in a room temperature, just in your drawer, in your dresser drawer, where it
stays at room temperature. Yeah. That's a great piece of advice. And very quickly, you were saying outdated medications. Stay away from them.
Outdated, yeah. You shouldn't. If you don't finish them, you should throw them out, because you shouldn't use them 2 years later, because most drugs lose their potency. But antibiotics can become dangerous.
Throw them out or bring them back to the. Can you bring them back to the pharmacy?
The pharmacist will dispose of them as well.
I could go on for so long talking with you, Mark Rosenhek, but I want you to talk to your pharmacist. How much schooling do you go through?
4 years.
4 years. I mean, basically, you guys are very.
It's more concentrated. We get 4 years of drugs, not like some the doctors, the other sectors that don't get as much in drug therapy.
Great resource is your pharmacist. Thank you very much.